Shigellosis is a foodborne illness, and it's caused by an infection of bacteria, more specifically the Shigella genus bacteria. Basically, you have water that is polluted with human feces. Now, it is basically transmitted through contaminated food or beverages. In other words, you have this feces that's contaminated with the bacteria that gets in the food or beverages. Typically, how that happens is food handlers don't wash their hands. Now, we can also have vegetables grown in contaminated sewage that could have the Shigella genus bacteria in them. Another way is eating food that's contaminated with feces. By that I mean, okay, let's say you have some flies, they come in contact with the feces and they transfer that to the food that you're eating. Another way of transmission is drinking or swimming in contaminated water. So, what exactly are the signs and symptoms? Well, first off, there's fever. Next, there's tiredness, or you get really tired. Another symptom is either watery or bloody diarrhea. Another sign and symptom is nausea or vomiting. And then there's abdominal pain. Typically speaking, symptoms will last up to 2 days, and usually the patient will get better within 5 to 7 days, or at least that's what happens in most cases. So, how is shigellosis diagnosed? Well, there's laboratory tests where they take a stool and they test it to see if it has the Shigella genus bacteria in it, and more specifically they want to know if it does, which type of bacteria, because there's more than one, which type of bacteria it has. And I put a question mark by antibiotics here because, okay, so if we figure out which type it is, we can figure out which type of antibiotic is effective against which particular strain there is. And that brings us to our last point, which is treatment. Well, a mild infection basically does not need any medicine. So a mild infection equals no medicine. Another form of treatment for more severe ones is antibiotics. There's ampicillin, and there's also ciprofloxacin. Now, one thing to keep in mind is that anti-diarrheal medicines are actually bad. Now, you say, how? Well, they take care of the diarrhea, which is good, but they don't do anything to take care of the bacteria, the Shigella genus bacteria. And even if you're not taking any medicine, you want to try to replace any fluids or salts that are lost by eating salty food or just having salt or drinking lots of fluids. And this essentially wraps up an overview for the Shigellosis bacteria. Thank you for watching.